All right, I'm Dr. Nicholas Jones, nip and tuck plastic surgery, and today we're talking a little bit about brachioplasty. So what is a brachioplasty? It's also called an arm lift, and it's a procedure that is done to get rid of excess skin of the arms and just improve the contour of your arms. Typically, I do this procedure in massive weight loss patients. So if you've lost a significant amount of weight, or you've had large fluctuations in your weight, and you have bat wings, or you just have excess skin, you just don't like the way it appears, or maybe it just makes it a little bit more challenging for you to fit your clothes, then this may be a procedure for you. Who shouldn't have a brachioplasty? If you have underlying medical conditions that are uncontrolled, like uncontrolled hypertension, if you've recently had a stroke or a heart attack, this may not be a procedure for you. If you cannot undergo general anesthesia, you may not be a candidate. And if you're actively losing weight, meaning your weight hasn't stabilized yet, you probably should wait until you get your weight stabilized. The way that I perform the procedure is I begin with liposuction, and the purpose of the liposuction is to debulk the arm. So I do what we call circumferential liposuction, meaning that we go all the way around the arm, remove the fat using power assist liposuction. And then at that point, I confirm my markings, and so the scar is made between your biceps and your triceps. That way, when you're in a repose position, the scar isn't apparent. And so it also, in this position, I find that there's not as much tension on the closure. And so my goal isn't to remove all the skin, because if we try to move too much skin, places lots of tension on your closure, and you can end up with your wound separating, which we call wound dehiscence. So close it up, minimize the tension, and then I place steri strips over the incision just to protect the skin until it completely heals. And once it's healed, it's very important that you perform scar therapy. And scar therapy at nip and tuck plastic surgery includes some type of silicone-based cream. Sometimes I use retinols. And for patients who have a heavy scar burden or keloids, we have a special protocol that those patients start approximately 2 weeks after the surgery. Other than wound care, wearing a baja or a garment, a sleeves to, again, compress the arm, keep tension off of your incisions. I do not use drains. And I see my patients typically the day after surgery, come in for a lymphatic massage. But the mainstay of the care after surgery is pretty much making sure you stay well hydrated. You want to make sure you have a well-balanced diet, because you want to consume enough protein so that it aids in the healing process. And of course, you want to keep everything clean. So my patients are allowed to shower the day after the surgery and limit their physical activity, no strenuous activity, for at least 3 weeks. And you want to make sure you're not raising your arm above 90 degrees, because anything higher than that is going to put excessive tension on the closure, and we do not want your incision to open up. Other than that, I also offer peptides. And we have a peptide stack that we give patients, or we offer to patients, that I feel aids in the healing process. I've had great results with that. We use what we call aesthetic recovery bundle. It includes GHK, BPC 157, TB 500, and Kispeptin. Usually I use this for about a month, and most patients say that they have a higher energy level, their scars look better, and lots of women, mostly my female patients, they love it just for their skin. So if you're thinking about a brachioplasty, you're not sure if you're a candidate, go visit our website or come book a consultation. Let's talk, and let's see if this is the right procedure for you.